Welcome to Envision Pass Podcast, preparing social workers for the licensing exam, providing critical insight, tips, and strategies to empower you to achieve your goal, your licensure. Please welcome your host, Tanisha Delph.
The way we think and behave makes up who we are, or personality. And we all have personality traits. Some of us are easygoing, friendly, confident, while others are sensitive, flamboyant, or shy. And we may also feel moody or suspicious of others. Today's podcast discusses the key elements of personality disorders, the clusters and differentials. On today's podcast, we're joined by Dr. Todd Daniel, Director of RStats Institute, Research, Statistical Training, Analysis, and Technical Support at Missouri State University.
I will pass. I am prepared. I will never give up. Visualize your future with your license.
There are questions on the exam that are based on personality disorders, and I really wanted social workers to be able to understand and identify the signs and symptoms, as well as the differentials of each disorder. Dr. Daniels, you know a lot about personality disorders. I've listened to your interesting podcasting series, Great Ideas in Psychology. But before we get into the meat of the various clusters, what are the key elements of personality disorders?
Well, there's several things that set apart a personality disorder from a typical disorder like obsessive-compulsive disorder versus an obsessive-compulsive personality disorder. And the big characteristic about a personality disorder is that it is pervasive. It's this enduring pattern of behavior. And it really falls into four categories. So there's four areas of life in which you will see the disorder manifest: thoughts, feelings, behaviors, and relationships. So in the thoughts, personality disorders tend to have the rigid thinking or extreme thinking or distorted thinking. With feelings, the way that they feel about what happens tends to be problematic, and so often they will respond with behavior in a way that is not well adapted. So they'll have impulse control problems, for instance. And then finally, relationships. It's difficult for someone with a personality disorder to maintain long-term relationships. That combination, thoughts, feelings, behavior, relationships, is what you will see with any of the personality disorders.
I certainly agree. A person with this disorder feels comfortable with their personality traits and believes that there is nothing wrong with their manner of thinking, functioning, and behavior. In other words, they perceive their personality to be acceptable. Dr. Daniel, do you believe that this type of personality is somewhat egosyntonic?
So it definitely impinges on that idea of egosyntonic and dystonic. In that, with personality disorders, the question is, does the person know that they have a disorder? And does the behavior bother them? So with a personality disorder, they tend not to recognize their behavior as a problem. Everyone else has the problem. Someone with a disorder like a obsessive-compulsive disorder, they know that they are acting obsessively or compulsively, and it bothers them, and they wish that they could stop, but they just feel like they can't stop. And in fact, so think about obsessive-compulsive personality disorder. This is someone who is very organized, very structured. They love lists. They love rules. And so they view everyone else as having difficulty following rules, not caring enough to make lists. They see their own behavior as being normal, and everyone else just doesn't know or care enough to be as concerned about order and structure as they are. Now, they try to impose that structure on other people, so they try to make you follow their structure, and then that is going to interfere with relationships. But they still don't think that they have the problem. They think you have the problem. So let me tell you some of the changes that have happened with the Diagnostic and Statistical Manual since we came out with the DSM-5. We have three clusters of personality disorders. They're cluster A, B, and C. One of the jokes that I always make about the medical field is that they are horribly uncreative when it comes to naming. So cluster A, B, and C, when you think of other disorders like hepatitis, A, B, and C, or a type A personality and a type B personality, we ended up with the same kind of nomenclature now with the DSM-5. So we have these three clusters. They're cluster A, B, and C. And cluster A is the odd, bizarre, eccentric cluster. Cluster B are people who are dramatic and erratic, the antisocials and borderlines. And then cluster C is all about anxiety. So very anxious, very fearful, sense of self, lack of sense of self in that cluster C. And what will often happen is people in one cluster, like an avoidant personality disorder or a dependent personality disorder, might find themselves drawn to someone in cluster B, like an antisocial or a narcissistic personality disorder. So sometimes those two will attract each other. And it's usually a lot of sparks in that relationship.
I will pass. I am prepared. I will never give up. Visualize your future with your license.
So let's talk about cluster A personality disorder. What does that look like, the odd and eccentric personalities?
Well, you have three types of personality disorders in that cluster A. The first one is paranoid. So if someone is paranoid, it's that idea that people are out to get me. And so they have a real distrust. They're very suspicious of others. Others are out to get me, and then they will look for clues to that out to get me behavior in other people's behavior toward them. So even though you are acting toward this person in a way that seems normal and pro-social and friendly, they are reading into your behavior that you are really secretly criticizing them. You are trampling on their rights. They're very sensitive, and then they bear grudges. They'll hold on to that. One characteristic that you will almost always see with paranoid personality disorder is projection. So if you point out something that they have done, they'll spin that back around. You're the one who has these unacceptable thoughts or feelings or behavior. They'll push that right back on you. So paranoid is the first. Schizoid or schizoid personality disorder is the second one. These are people who are just detached. When you see someone who is schizoid, you see someone who just seems indifferent to the world around them. They don't have a strong emotional response to other people. But what's interesting about this personality disorder, there's a theory about schizoid personality that really what they have is this rich inner life, this sensitive life, and they're experiencing a longing for intimacy. They want to be close to people, but they find being close to be distressing. And so they retreat, they withdraw back into their own inner world. So schizoid personality disorders tend to be actually well-functioning.
And also, a person with this disorder often show lack of emotion, what is considered as a flat or blunt affect. So if you have a client with schizoid personality disorder, you may never see them smiling at anything, and they may appear cold or detached. So what I'm understanding is that it's a preference to be alone, which is why they're considered as loners.
I guess with schizoid, lack of interest. There's just no desire. They don't necessarily want to be friends with people. It's not that they're antagonistic toward people. They just don't care. They're just not into people. They don't desire sexual relationships. They don't desire friendships. They're just pretty much indifferent about people around them. So there's a third personality disorder in this cluster A, which is called schizotypal or schizotypal or schizotypal. You'll hear it pronounced in different ways. It sometimes is confused with or overlaps with the schizoid personality disorder. With a schizotypal disorder, you see the oddities, the way they look, the way they act, the way they talk, and it's with schizotypal closer to schizophrenia than schizoid personality would be. So with schizoid, you could kind of see maybe the negative effects of schizophrenia or the negative responses where people are withdrawn. But with schizotypal, you get the positive effects. So the things like the magical thinking and the odd belief systems and some of the suspiciousness and the ruminations that are more characteristic of the active side of schizophrenia. But both schizoid and schizotypal will avoid people and avoid social interactions.
So, Dr. Daniel, let's skip over cluster B personality disorder. I believe that is a very interesting cluster of personalities to discuss, and I want to save that for last. Let's move on to cluster C, avoidant, dependent, and obsessive compulsive personality disorders.
I will pass. I am prepared. I will never give up. Visualize your future with your license.
So with cluster C, you get people who are avoidant of others. So you kind of can feel that that overlap with cluster A. But it's the way that they interact with others around them or with their environment. So let's start with avoidant personality disorder. These are people who they don't avoid people because, like a schizoid personality disorder, they just don't care. It's not that. They do care, but they feel socially inept. They feel that if I put myself out there, if I meet other people, they're not going to like me. I'm going to be embarrassed. I'm going to be rejected. I'm going to be criticized. And it's that fear of rejection, that fear of criticism that makes them want to avoid being with other people unless they knew for sure that they were going to be accepted. So it's this strong sense of people will see that I am not good enough, and so I don't want to risk that rejection. I'm going to avoid the possibility of experiencing that rejection.
So I'm also thinking about a person with this disorder who rejects a job interview due to fear of being denied the position. For instance, if there's a question on the exam that states, a client who has been meeting with a social worker for an initial session expresses to the social worker that she struggles to maintain close relationship and states that she refused to find a job because of her fear of being rejected and that she doubts she will fit in. So we're seeing the signs of fear and isolation that can lead one to the answer choice of avoidant personality disorder. This client not only is isolating herself out of fear of not getting the job, but she also fears of others judging and criticizing her. Can you explain more in detail the difference between schizoid personality disorder and avoidant personality disorder?
A lot of it has to do with their desire to be with people. So an avoidant personality disorder individual is going to want to be with people, but be scared of doing so. So there's the anxiety of being with other people. Schizoid doesn't care. They are indifferent to being around people. Now, the result is similar in the withdrawal from others, but the withdrawal is for different reasons. With avoidant, it's because of anxiety, whereas with schizoid, it's because of indifference.
So let's move on to dependent personality disorder, which is a person who often appears clingy to others due to fear of losing them. They find it difficult to make decisions on their own and often seek guidance even for the simplest things.
You're exactly right. It's that lack of self-confidence. They do not feel confident in themselves, and so they're constantly looking outside of themselves for validation, and that can come across as clingy. It's this need to be cared for. Now, what this means for relationships is early on in a relationship, a person with dependent personality disorder might make you feel like you are the most important person in the world. Everything you say is wisdom, drops of, pearls of wisdom being dropped upon them. Everything that you do is wonderful because what they're wanting to do is ingratiate themselves to you. And early on, this feels wonderful. But what happens is over time, the person with dependent personality disorder turns to you for everything. Things that you think they should be able to take care of themselves. They want your advice and your input on every little thing, and that begins to weigh down the relationship. So this is someone who feels inadequate and helpless, and so they give up the personal responsibility and sort of arrange themselves under someone else who is stronger and smarter and protective, and want that person to sort of live their life through them.
So these individuals are so dependent that they're unable to function on their own and have this belief that they need someone to guide their life.
Oh, yes. And they will often find themselves attached to someone, perhaps with a narcissistic personality disorder. And we're going to come back to narcissism, but that's a characteristic that wants to be admired. So a person with dependent personality disorder wants to have someone to admire, and a narcissist wants to be admired. And so they might be drawn to each other, and that might work for a short term, but neither one of them are going to be able to maintain that long-term relationship. And what you can imagine with dependent personality disorder, this is someone who's going to be very vulnerable to exploitation, to abuse. They're very dependent. They're looking like a child. They're dependent upon someone else, and that really sets them up for someone who would take advantage of them.
Dr. Daniel, we are at our final disorder for this cluster, and that is obsessive-compulsive personality disorder. And people with this disorder are often called perfectionists. And according to the DSM-5, they're overly attentive to details, rigid with rules, and feel compelled to make detailed lists.
That's exactly right. The DSM-5 terminology for this is the anancastic personality disorder. It means arising from compulsion. So to understand and I'm just going to call it the obsessive-compulsive personality disorder, you need to understand what are obsessions and what are compulsions. So obsessions are thoughts, compulsions are behaviors. The obsessions, the thoughts, cause or arise from anxiety. And then the compulsion is a behavior that mitigates the anxiety. And this can be perfectly healthy. So, for instance, during flu season, you get a little more obsessive about avoiding the flu. You have a little anxiety about not wanting to get sick. So the behavior that helps to mitigate that anxiety is washing your hands more frequently, not touching your face, not shaking hands with people, maybe avoiding people who are coughing and sneezing. So you have a behavior that mitigates the anxiety, perfectly healthy. With an obsessive-compulsive disorder, not personality disorder, but obsessive-compulsive disorder, a person is using that compulsion, that behavior, to mitigate the anxiety, and the compulsion is causing a problem. Maybe they're washing their hands too frequently, or they're spending so much time counting or checking that is interfering with their life. So a person with obsessive-compulsive disorder knows that they have it, and it troubles them. Obsessive-compulsive personality disorder has the obsession, the anxiety, and their compulsion then is a preoccupation with details, with rules, with law, with making lists, with ordering and organizing and scheduling. So you describe that as perfectionism. That's exactly right. But a person with obsessive-compulsive personality disorder is going to want to organize you as well. So if you are a friend or a relative or a child of this person, they want to order and structure you, and that's where the problem comes in. And so when a person with obsessive-compulsive personality disorder starts having trouble in relationships, they feel their behavior is perfectly normal and perfectly reasonable, and they care enough to do things right. You're the one who refuses to be organized. You are the one who resists the rules. And so they're rigid, they're controlling, and yet that behavior seems perfectly normal. So that's what makes something a personality disorder, the behavior that is causing the problems. The person with the personality disorder doesn't have insight into the consequences of their behavior.
So, Dr. Daniel, we decided to save the best for last, Cluster B, which is a very interesting topic, and we'll explain why.
I will pass. I am prepared. I will never give up. Visualize your future with your license.
Cluster B is different than A and C in that you have seen and experienced people with these personality disorders. Now, in general, personality disorders, or let's put it this way, about 10% of people are affected by a personality disorder. But people in cluster A or C, you're less likely to encounter them or maybe recognize that disorder. Whereas people with that cluster B, the dramatic, erratic cluster, you know them, you have experienced them. They're the ones that get the most press, if you will. So, for instance, antisocial personality disorder. That was actually the first personality disorder. The word personality disorder was really applied to antisocial. And then it was broadened eventually. An antisocial personality disorder, this is someone who you would recognize from their lack of concern for others, but such a callous lack of concern that they will harm other people. They have no regard for rules, for social obligation. They act impulsively, and they don't have a sense of guilt. And on top of that, they often, almost always, fail to learn from their experience, except in learning from experience on how to better manipulate other people. So a person with antisocial personality disorder, obviously you're going to see more of that in people who have been incarcerated. But don't forget the other side of that, because personality disorders, because they're so woven into the personality, people with personality disorders tend to be more highly functioning. Whereas, and I'll click back real quick to obsessive compulsive disorder, people with OCD know they have it. It causes problems. That takes up a lot of energy. A person with an obsessive compulsive personality disorder, they can go merrily along with life, thinking that the problem was with other people. That same characteristic you see with antisocial people. So they can be highly functional. They can rise to high levels of position in a company, in a business, and you can see them, experiencing them, work for them. You will see them out in the wild. So it could be more of a CEO personality, or it could be someone who's been incarcerated. Now, the others that you will see with this cluster are borderline and narcissistic personality disorders. So a borderline personality disorder is someone who has a lack of a sense of self. And because they feel empty, they fear not having someone around to fill that emptiness, and that comes out as a fear of abandonment. So very intensely intuned to other people leaving them. There was a book written about borderline personality disorder called I Hate You, Don't Leave Me. So they have these intense, sometimes angry, sometimes violent relationships. That emotional instability plays out in the relationships. But if you say, I've had enough, I'm out of this relationship, I don't want to be with you, then that fear of abandonment rises up again. And now they want to draw you back. No, don't leave me. I promise I'll change. No, I won't do it again. It's that push and pull that happens with a borderline personality disorder. And in fact, it was called borderline personality disorder originally because it was thought to be like on the borderline between neurosis and psychosis. So there's a bit of disordered thinking that goes along with this, but it's also highly anxious.
And these individuals are often involved in impulsive and risky behaviors and are prone to suicidal tendencies. So they have a greater risk of suicide attempts and self-injuries.
That's exactly right. And it's that lack of a sense of self that drives borderline. There's another characteristic or another disorder called histrionic personality disorder, which is a lack of a sense of self-worth. So if borderline is lack of a sense of self, histrionic is lack of a sense of self-worth. So they need others to validate them. And unlike someone with a dependent personality disorder who just finds that one person who can fill up the emptiness, histrionic personality disorder individuals, they want attention and approval from everyone. So histrionics, the Latin derivative of that word, is about acting, being on stage, being noticed, being applauded, getting attention, getting the attraction of others focused back on them. You can imagine how what a grind that would be in a relationship to constantly need to provide affirmation to someone with this histrionic personality disorder. And so this is someone who's going to be looking for that approval and that attention outside of themselves in multiple ways.
I guess in my mind, I'm picturing someone that has a seductive appearance, someone that you'll see wearing something outlandish and behaves inappropriately that is often flirtatious. That's
exactly right. I think in an age of social media, you don't have to look too far to find people who are attention-seeking, who are just craving approval.
And now we're down to our final disorder, narcissistic personality disorder. And I often think about this disorder, especially relating to people in the political arena. And oftentimes these individuals are boastful, a sense of grandiose. They believe that they are better than others and are entitled to special privileges. They have little or no empathy for others, so they ignore others' feelings or needs.
Well, Tanisha, I can't imagine why you would be thinking of narcissistic personality disorder so regularly, as though we were constantly being exposed to the presence of that disorder in our culture. This is someone who has an inflated sense of self. They are self-important, and because they're so important, they have a sense of entitlement that people owe me the attention that I deserve, a need to be admired. As a consequence, they need to be at the center. If other people are getting attention, they become very envious of other people. And so if this person was a leader in some way and others around them were suddenly getting attention, it would be very common that you would see that person with the narcissistic personality disorder cutting out that other individual. You'll get fired very quickly if you're getting all of the boss's attention. This is someone who has high expectations of others in the way that others treat them or admire them, but they lack empathy and they have no sense of loyalty back to other people. So they want others to be loyal to them, but will not extend that same quality back toward others. So as a result, everything this person does is built around maintaining that sense of self-importance. Often, this person knows or suspects or has this nagging sense of being a fraud and being found out and being pointed out that they are not nearly as important as they want to present themselves in being. So the way this is going to work out is the person with a narcissistic personality disorder is going to be have a loose relationship with reality and truth, in that whatever they say that builds their sense of self-importance is the truth. To other people, this might seem like a lie, because what this person is saying doesn't comport with reality. But for the person with narcissism, anything that they say that builds them up must necessarily be true, whether or not it could be backed up with fact or evidence. And they will exploit other people to get to that end, into that goal. If you obstruct someone with narcissism, if you get in their way, if you embarrass them or ridicule them, there's a narcissistic wound, is how it's described. This core part of the self where any ridicule, any pointing out that you are anything other than the most important individual in the world, will trigger a narcissistic rage. That is a visceral response that can be very destructive, and it can be destructive toward the individual and toward others around them. And when you watch this, you might think, why doesn't this person just let it go? You have so much more to lose by calling attention to this insult that was offered, and yet they can't let it go. Any insult has to be addressed. It has to be addressed with greater forcefulness than it was offered. And so this person strikes back with even greater intensity to what might otherwise be even an unintentional slight. Anything that pokes that narcissistic wound can trigger the narcissistic rage. So, again, I don't know if you've ever seen anything like that in the real world, but there is such a thing as narcissistic personality disorder.
So we've covered a lot of grounds. How can we summarize this for social workers who are preparing and about to take their exam?
So let's review the key elements of a personality disorder, and then we'll review the clusters of personality disorders again. So what is it that makes something a personality disorder? 4 things: thoughts, feelings, behaviors, relationships. All of these personality disorders have rigid thinking or extreme thinking or distorted thinking patterns. Feelings don't match reality. There's a problem in the way that they respond emotionally to the world. The behavior, typically impulsive, like impulse control problems, or a behavior that actually exacerbates the problem. And most of those problems, of course, are relationships. It's difficult for someone with a personality disorder to have an enduring, long-term relationship with another human being. The DSM-5 gives us the 3 clusters, A, B, and C. Cluster A is the odd, eccentric cluster. So these are people who withdraw or are skeptical of others. So paranoid, schizoid, schizotypal. Withdrawn, keep a distance between themselves and others. Cluster B is the dramatic, erratic cluster. These are people who have something in a lack of self in some way. So antisocial personality disorder, borderline personality disorder, histrionic, and narcissistic. And then finally, cluster C is the anxious and fearful cluster. So these are people who also avoid other human beings, but for different reasons. So avoidant, dependent, or obsessive-compulsive personality disorders. So before we wrap up, I did want to mention something about the treatment of personality disorders. Treating personality disorders is very difficult because many times the person with the personality disorder doesn't want to change. They don't feel as though they have a problem. And also because this personality disorder is so woven into their personality, it's something that is very difficult to move. They often lack insight into the fact that there is a problem or insight into the severity of the problem. So there are modalities for treatment, but it is much more difficult in treating a personality disorder than it would be in treating a typical disorder.
Visualize passing the exam. Visualize your future with your license.
Once again, thank you so much for joining us today, Dr. Daniel. I definitely learned a lot, and I do hope that this was helpful for our listeners. Remember, study the 10 personality disorders, know their clusters A, B, and C, and it will take you a few steps closer to passing the exam.
Thank you for listening to the Envision Pass podcast with Tanisha Delph, the podcast designed to assist you through your journey towards passing the licensing exam.